couple of minutes?
I'm not saying a word.
You're not?
No.
Oh, come on now.
My lips are sealed.
It's not going to hurt anybody's feelings.
Oh, yeah, it will.
All right, now, before you make up your mind, just think about it.
Okay.
Least favorite. I don't know why I want to know that.
You're so persistent.
I know. Now, most of us who have spent any time in a hospital think of nurses as highly competent, sympathetic, and certainly totally dedicated to their patients and their profession. So the idea of a nurse who would kill or hurt is very difficult to understand, particularly a nurse who would make a patient have a heart attack, also that he or she could rush in and save the patient, thereby looking like a hero. But as tough as it is to believe, it does happen. Rare, but it does happen. Nurses have been convicted in Texas, California, and Michigan. And currently in Maryland, this woman is awaiting trial on 3 murder and 7 assault counts. Police say she injected her patients with potassium, causing cardiac arrest. The Center for Disease Control started an investigation when 57 of her patients had heart attacks. What would drive a nurse to do something like this? Bea Yorker has done extensive research on this syndrome. She heads the Department for Psychiatric Nursing at Georgia State University. First of all, Bea, what would cause someone to do something like this, and do they intend to actually kill a patient?
Well, this is purely speculative because even the nurses who are in jail are still maintaining their innocence. So it's very hard to find out what their motives are or what would make somebody do an act like this, which is induce cardiopulmonary arrest in a patient. Some observers at the scene of the nurses who've been convicted have commented that the nurses are exhilarated or appear excited after a resuscitation. And this is like a code 99, you know, where all the doctors rush and sometimes the electric paddles are put on a patient and so on. It's a resuscitative effort. But keep in mind that this is retrospective. People will think back once the nurse has been singled out as being suspicious, and then they'll say, well, now I remember that this nurse, you know, behaved in a very excited way. Also, participating in CPR or in resuscitation is an adrenaline experience. You can imagine it's, you know, like running a race or something like that. People will be hyped up after an event such as this.
I would think that anybody would get excited during a procedure like that.
So that's not really indicative. I wouldn't have anybody be alarmed because a nurse is excited after CPR.
All right, then what about post-event evaluation for these nurses? What about their mental state of mind? What about psychiatric evaluation?
Well, from my studies, only 2 nurses have had a psychiatric history. It's been, again, speculated by people who've known them in their childhood that some of them have had troubled childhoods. But for the most part, they are not psychotic, and that means deranged or out of touch with reality. These nurses are not mentally ill.
Now, in the Maryland case, what led the CDC to suspect one specific nurse?
Well, they did association studies looking, first of all, at which shift most of the arrests were occurring on, and it was the evening shift. So then they looked at all of the healthcare personnel, nurses, physicians, pharmacy people, respiratory therapists. Everybody was evaluated, and they looked at presence of personnel and linked it to occurrence of cardiopulmonary arrests, and that's how they isolated it. And their statistics are well tested. They had outside objective consultants evaluate their findings, and they looked at it from many different angles.
So there was no other way than by intervention that the cardiac arrest could have occurred on
Well, they
these
ruled out
patients?
several other possible causes. For example, could it be that another person working the same shift as this nurse and the same hours was actually causing them? And they ruled out that it could be other people. They ruled out that it could be she had a lower threshold for calling a code. You know, for example, if a patient just looked flustered or short of breath, that maybe she was very sensitive and would call a code. And they said, no, that wasn't one of the causes for having all of those.
But B, in this particular case, and I must stress again that this is alleged, but the fact remains that 57 of 88 cardiacs were with her, where she was one of, if not the primary caregiver.
Exactly, yes.
Well, where's the hospital's responsibility as far as cross-checking, or what do you do? At what point do you say?
Yes, what do you do when you're going to the hospital?
How many do you have to
yourself?
have before they say, wait a minute, there's something really wrong here?
Well, that was a lot. And there was a case in Georgia where I think the hospital acted in an exemplary fashion. They got within a month of suspicious cardiopulmonary arrest, the same thing on one shift, they instituted a protocol where potassium chloride, which is the suspected agent in both these cases, was made a controlled substance. So the nurse had to sign it out each time she uses it. Now, potassium chloride, you know, is a common substance, and it's readily available on most hospital units. So the hospital took control. They also took blood measurements of every patient that had a cardiac arrest on the floor. And that deterred any further suspicious occurrences. So that's what I want to encourage hospitals to do, is to go ahead and set up early surveillance, maintain confidentiality, and then institute protocols that would deter nurses.
What are the nurses feeling now? I would imagine kind of they're a little jumpy, because I'm sure that if something happens in a hospital and there's no immediate cause given, that they might be the first ones that would be suspected. And how are they reacting to that?
Unfortunately, nurses are ready targets for investigation and suspicion. And that's why it's so important for hospitals to not go to the press, to not leak to the media, or irresponsibly handle the situation, because it can violate a nurse's civil rights to have her wrongly accused. It can really impede any kind of legal process to have all this stuff out in the open. But yes, nurses can be scapegoats in these kinds of situations.
Our guest is Bea Yorker, and let me add that today, especially today, with the enormous numbers of hospitals and, of course, hospital personnel, do check with your doctor, because they generally would have some insight into how well a hospital performs. Am I correct?
Yes, and the head nurses, too.
Good. All right. Thank you very much for being with us. Dog trainers sometimes use methods that can hurt the dogs that they're trying to teach and help. Animal expert Warren Eckstein will be with us and show some things that may shock you when we return.
I think it's more exercise related. People are used to being outdoors this time of year.
The abundant water supply has meant a slump in the sales of water in Cobb County, and the Water Authority is considering raising the rates to try to make up for the lost revenues.
So, what's in store now? More rain? Well, we're going to check with Ken Cook, who's in the Forecast Center, to tell us. Ken?
I think there's still going to be more rain for some, Brenda, but it's going to be more scattered.